I have been inundated with this question: do I really need a second booster shot? From friends, relatives, patients, and of course you, as well as colleagues now who is asking, do I really need a second booster shot? Who needs, who doesn't? And remember, the virus has adapted. This is now beyond Omicron, it's gone on to BA4 and 5. Thus, boosting with an ancestral strain-based vaccine help. So this video will answer the question. Actually, in fact, there are 4 questions which you need to ask yourself to answer the question, do I really need a second booster shot? Stay tuned. If you are in a rush, go right to the end of the video where I'll ask the 4 questions on you. Answer the 4 questions and in turn, you'll be able to know if you need a second booster shot. Before we go into the 4 questions, we should look at the science, the scientific evidence for the second booster shot. And I'm going to give you the context at which this is discussed. At this point in time, which is late June 2022, we have individuals who have had many shots of vaccines. From the initial 2 doses of mRNA, a complete vaccination now is defined as 2 mRNAs and 1 booster vaccine. So in total, the individual would have received 3 doses of mRNA vaccines. This is really quite different from the initial vaccine trial because they only used 2, but the booster was shown to help reduce down the risk of infections as well as morbidity and mortality. That was the context. But the virus has adapted. The virus has adapted and tried to overcome all these immune defenses. It's as if it knows that the antibodies are targeting this area, it changes it so that the antibodies are not so effective. It's adapted to form BA4 and 5. These are the 2 variants that are taking over the world at this point in time. And not only when they take over the world, we see an increase in number of cases, there's an uptake, or some people have a wave, there are more and more cases spreading worldwide. Will this make problems for the hospitals? Are there going to be more admissions? Are there going to be more deaths? Lastly, we know for a fact that Omicron or BA4 and 5 will result in infections again and again and again. There are going to be more and more cases of reinfection and they are better described. And when there are reinfections, you risk getting morbidity and mortality. People can be very sick and people can die. So with this backdrop, we look at the evidence for a second booster, and this comes from this very important scientific paper which is published in the New England Journal of Medicine on the 5th of April. This is work done by the Israelis where they looked at the 4th dose of the Pfizer BNT162b2 vaccine against the Omicron in Israel. The vaccine's name, the commercial name, is called Comirnaty. How effective is it in actually preventing infections? How is it effective in preventing severe infections? We're going to go in a little bit of specifics into the study. So on the 2nd of January 2022, just about 6 months ago, Israel started giving a 4th dose of the Pfizer-BioNTech Comirnaty vaccine to people who are 60 years old and above. So it's actually a big study. More than 1.2 million people participated. And these are individuals who are more than 60 years old. They looked at the 3-dose and the 4-dose regimen. That means those who are not given the 4th dose yet, those will be the comparator group. Immediately out of the 3-dose or the 4-dose, you can find those who are infected. And thereafter, you can compare against those who develop severe disease. You can immediately see there are 2 groups you can compare them against. You can decide then if the 3rd dose works better or the 4th dose. And what were the results? The results demonstrated that there was a significant difference between the 3rd and 4th dose. With the 4th dose, there were fewer number of severe COVID cases, Whereas the third 3-dose regimen, there were more cases of severe case COVID-19. You do a comparison, there's a reduction of about 2.6 times risk of getting severe COVID-19 if you went for the 4th dose, or what you call the second booster. And mind you, this is for severe COVID cases. We're not talking about whether the person fell sick with COVID or not, but requiring hospitalization, requiring oxygen supplementation. Now we're going to look at the benefits of the 4th dose in preventing infection. I want to stress to you, this is infection and not preventing severe illness. Let's look at the data, and you need to follow the blue dots. The blue dots represent infection risk. Immediately after vaccination, you notice that there's a benefit of about 2 times risk reduction in preventing infection. Thereafter, for the next 2 weeks, it kind of hovers about the same, but clearly by the 6th and 7th week, you notice that the numbers, or rather the benefit, is coming down. Towards the 8th week, there's very, very little difference between the 3rd and 4th dose in preventing infection. In other words, preventing infection doesn't last. We can get a boost initially, but by the 3rd month, the risk comes back to almost normal. And that's exactly what we're seeing in real life. When you get infected with COVID-19, for the next 1 month or so, you'll be recovering from it, but people as early as 1 month after the first infection gets infected again, certainly by the 2nd month as well as the 3rd month. In other words, we're going to get infection again and again and again. That's for the real virus, and it certainly will happen for the vaccine. But mind you, this is infection, this is not preventing a severe illness. Let's now look at protection against severe illness. Now we're going to look at the 3rd versus the 4th dose for protection against severe illness. There you have it, and this time round is the red bars. Let's follow the red dots and the red bars. Immediately by the 2nd or 3rd week, we do see an advantage. It's up to 2 to 3 times benefit in preventing severe illnesses. As you go on to the 4th, 5th, and 6th weeks, you realize that the protection kind of stabilizes and remains just as high. In comparison, the blue dots fall, but the red dots remain high. In other words, there is a persistence in protection against severe disease, and this protection lasts. That's very important, which means even with the vaccination with the 4th dose, I may get infected again at the 7th or 8th week, but I am protected against severe disease. To me, that is more important. I can imagine everyone's asking, why does this happen? It's actually very simple. It boils down to 2 arms of the immune system, the B cell and T cell, and I'm going to repeat a similar slide which I've talked about previously. The body has 2 types of immune system to actually fight with these repeated viruses. You have the B cell immunity. B cell immunity is about antibody production. Think of it as machine guns with ammunition that's shooting out in the air. As the virus tries to come into the body, the antibodies are like machine guns that will take down the virus. And at this point in time, we know that immunity is restored with 3 doses, hence the concept that you need 3 doses for the basic vaccine protection. And this is before the days of the 2nd booster. In the case of T cell immunity, it's very, very important. T cell consists of cells like CD4, CD8. That's the cytotoxic T cells, helper T cells as memory T cells. They help to augment the immune response to the virus. Why the difference? Well, the mechanics are different, and very importantly, they play different roles. In the case of antibodies, it's the first line of defense. When the virus tries to attack, these machine guns that are firing off will try to negate and block off the virus. It's the first line of defense. In the case of T-cell immunity, it's actually the second line of defense. It determines how sick you become. If you understand immunity in the form of antibodies, they are very specific. It's like a lock and key. It has to fit. So if there is a mutation in the virus, then the antibodies doesn't bind so well. So mutation of the virus allows it to evade this B-cell immunity or the antibody immunity. However, in the case of T-cell immunity, it is less affected by mutation. In other words, the spike protein will change somewhat, but the T cells still able to recognize it and cope with it, and in turn reduces down the severity of illness. I've said this before, for the B-cell immunity, the antibody bindings determines if an infection will occur. But the T-cell immunity tells a different story. It tells me if you end up with severe diseases or not. Now I'm going to try to simplify this even more with the next set of slides. So when a fight occurs, first there's the B-cell antibodies, and then after that the T-cell immunity comes along. So you can imagine the virus comes here, the B cells will try to block it with antibodies shooting into the virus. But because of mutation, the virus will evade this antibodies attack. And this is where the virus will go through the first line of defense, and in turn it hits the T-cell antibody response, and the T-cell antibody will negate the virus effect. In turn, you have milder diseases. So what does that translate to real life eventually? Very simple. Let's look at the antibody levels. After the vaccination, there you go, the antibody will rise up very, very nicely. But as you realize, the antibody levels will fall with time, and it comes down, comes down, comes down. It falls to a certain level, and you're going to get infection. With infection, then the antibodies gets boosted up, and this time around, there's training for the antibodies to match the infecting virus better. The levels rises, it gets boosted by infection, but like antibodies in other situations, the levels will come down. When it fades, it falls to a certain threshold, you get infection again. So what happens? It gets boosted by infection, the levels go high, and then with time, the antibody levels will fade again. And the whole story is repeated again and again and again. We are going to get repeated bouts of infection. What then matters? Is it because I'm falling sick? I mean, in the days pre-COVID, all of us have a sniffle every now and then. That's the infection trying to happen. But as long as I have it mild, I am not worried. As long as I keep my patients out of the hospital, back at work, I'm fine. I'm happy. So the question then is, how sick will you be? And it really boils down to your T-cell immunity. If you have good T-cell immunity, you're going to be great. But if you have poor T-cell immunity, your T-cell is low, you're going to end up with quite sick. If your T-cell immunity is very good, you're going to end up with very mild illness. There you go, severe disease from poor T-cell. If you have moderate T-cell, then you're going to have a mild to moderate disease. But if your T-cell is excellent, you may actually get an infection, but it may be asymptomatic. You won't even know about this. And you do know such people exist. They are found to be positive for COVID-19, but they have no symptoms at all, and they are totally well. These are the asymptomatic group. So that is what that really matters. If we're going to get repeated bouts of infection, what then is important is that each infection is mild infection. So the most pertinent question then is, does the second booster shot give me the advantage to prevent severe illness? My role as a doctor, or even for my own self, I want to prevent a severe illness, and that is the goal for the vaccine for COVID-19. How do I decide? 4 questions. These are the 4 questions which I ought to ask. Now the 4 questions. First question is, how old are you? Obviously, the older you are, the greater the risk there is, and the more the benefit. What about comorbidities? If I have other conditions that predisposes me to bad COVID, what are they? There's obesity, if your BMI, body mass index, is more than 30, or I have existing heart diseases, where I have bypass surgery, or I have a stents inserted, or the doctor says I have ischemic heart disease. Mind you, we exclude those people with hypertension. Hypertension is not sufficiently significant comorbidity. If I'm known to have kidney or liver failure, they don't work well, then I'll be concerned, or I have poorly controlled diabetes mellitus. If my diabetes mellitus is beautifully controlled, it's not really a risk factor. Poorly controlled one with a high HbA1c of more than 8, certainly we need to think about having this is a significant comorbidities. And of course, the usual risk factor of cancer, chemotherapy, immunosuppressive agents. You might be taking medications that suppress your immune system, but it's not because you have cancer, but other autoimmune conditions, whatever, like SLE or rheumatoid arthritis. Some people are born with immunodeficiency syndromes. Then you are also at risk of having severe COVID-19. The third question will be, how was your last mRNA vaccine? We know some people felt very, very bad after the vaccination. Some even had myocarditis, chest pain, breathlessness, or some developed neurological complications. Majority have been fine, but you have that odd case with weird, unusual vaccine effects. Very rare. So if you had it severe, should you think about getting vaccination as a second booster? If you have no effects at all, well, all the more you should consider getting a booster, since it is quite harmless for you. Now, so for the fourth question, it will be, how was your last COVID infection? Amongst these people going for the second booster shot, some already had infection. Some had it very, very mild, nothing more than a sniffle without even a sore throat. Some people had it very, very severe where they need to be hospitalized and had pneumonia, etc. This will determine if you ought to have a second booster shot. So in terms of age, how old are you? If you're more than 70 years old, just go ahead for the second booster shot. Because when you're 70 years old and above, your immunity with the vaccine training after 3 shots is nothing compared to someone who is 20, 30 or 40 years old. So you kind of need another remedial class to train your body better. So 70 years old and above, please go for your second booster shot. You will clearly help you. But if you are 60 to 70 years old, will it benefit you? Yes. The study from New England Journal of Medicine done in Israel says it is beneficial. But I do know of some people who are 60 to 70 years old who are extremely healthy, who are very, very fit, no comorbidities or sort, and they may have had bad reactions to mRNA. Or they had a COVID infection that was really very mild. So between the 60 to 70 years old, I would encourage you to go for the vaccine because there is science saying that you reduce down the severity of illness. But if you are really very healthy with no comorbidities, that includes poorly controlled diabetes, heart problems, etc., and you have bad reactions to mRNA vaccine, maybe you want to think about it. For the less than 60 years old, this is optional. And I think the key question for the less than 60 years old is, do you have any comorbidities? If you have comorbidities, you may want to consider it. Otherwise, you may not benefit much from the vaccination booster shot. So now the question of, do you have any comorbidities? We're familiar with the list: obesity, BMI that's more than 30, heart diseases that excludes hypertension, If are known to have kidney or liver failure, poorly controlled diabetes mellitus, again, those with poor controlled diabetes mellitus, example HbA1c is more than 8, then I'll be concerned. If I cancer or chemotherapy, or it might be on immunosuppressive agents, agents that suppress my immune system, or congenital immunity issues. If are any of the above, I should just proceed for the second booster shot. You are at greater risk of severe COVID-19. Third question, how was your last mRNA vaccine? Was it mild reaction? Was it well tolerated? If it was, consider vaccination because it is really quite harmless. In contrast, I do know of people who have had bad reactions such as myocarditis, pericarditis from it. And for such individuals with bad adverse reactions, we actually discourage them from going for another mRNA vaccine. So you kind of, at the end of the day, you weigh the need for vaccination based on your age, comorbidities, and how bad your mRNA vaccination was. And if you have bad reactions, you must be prepared for similar or even more severe adverse effects with the next dose. So remember, look at your last mRNA vaccination. How bad was it? Was it tolerable or intolerable? Fourth question, how was your last COVID infection? It was very mild and well tolerated. Looks like your T cell is doing a good job. If you get a second booster again, it will train your T cells further. But do you really need it? With the virus happening as BA4 and BA5, you can kind of rain check on the second booster if your last COVID infection was mild or well tolerated. You may not benefit much. You will benefit, but is that incremental benefit sufficient? Make a difference? Is it even significant? And after having had two vaccines or 3 vaccines followed by an infection, you have what we call hybrid immunity. That actually helps train your body, and your next COVID infection should presumptively be milder. What if you had severe disease and you're hospitalized your last COVID infection? If you were hospitalized, then I'll say you have severe COVID the last time, please get yourself a second booster because you need to train your T cells better. Again, the idea of vaccination now as a booster is to train your T cells and not so much your B cells. Hybrid immunity, together with a booster vaccination, will in turn help reduce down the risk of severe illness. And that's what we really want. We're not talking about preventing infections, but preventing severe COVID-19. Now, this is the summary slide. Remember this, infection is unavoidable. We instead want to aim for mild COVID infections so that we could go back to work, we are not hospitalized, we don't burden the healthcare system. We expect infections to occur again as quickly as 1 month after the first infection, and certainly by the 3rd month thereafter, because the natural history is that the antibody levels will fall with time. Immune system, very simply, think of it as a B cell line and T cell line. You have your first line infection, which determines if you're going to fall sick. The second one determines if you're going to have severe illness. So B cells and T cells, that's very important. And then lastly, think about your risk. What's my age? What are my comorbidities? Do I have heart problems and poorly controlled diabetes? How well did I tolerate my last mRNA vaccine? Was it a walk in the park or I developed severe adverse effects? And when I fell sick with COVID, what was my disease severity? Was it very mild or was it very severe? With these 4 questions in mind, you can then decide if you will really benefit. That comes to the end of the talk. Do you have a follow-up question on this? Let us know. Leave us a comment. We would love to hear from you. And remember, click subscribe and follow this channel. We want to answer questions on infectious diseases which you may have. At the end of the day, it's about making science simple and relevant for everyone. Bye!